We're back in our dental room, and you can see on the table we now have Oliver sedated for the dental procedure. I have Jackie with me. She is our lead and head nurse for the dental department. Jackie has had extra training by specialists in the department and certification to do this procedure. As all of our nurses that will be performing any dental procedures here, they have that extra training in periodontal disease and treatment. Tatiana, she's our assistant. She helps with charting and overall monitoring the patient. So as you can tell that we talked about earlier, some of the risk of anesthetic, that we try to minimize those risks. You can see we have the IV catheter, flowing to help keep fluid flowing through the body, make sure we help maintain the blood pressure. We have a warming blanket. It's very, very important that the patients maintain as close to their normal body temperature throughout the procedure as we can. So it has warm air coming through this blanket to help keep Oliver nice and warm. As you can tell, anesthetic machine into the endotracheal tube, again, the gas anesthetic to help us stay sedated throughout the whole procedure. Not only do we have the monitors that help us monitor the heart rate, the percent of oxygen in the body, so we can pick up any irregularities, any breathing pattern changes. Not only do we have our monitoring system, but we also have Tatiana. So she will do manual with her stethoscope. She will also listen to the heart rate. She will do watch the breath and everything else. So we got kind of a double checks and balances under the anesthetic. Again, safety measures put in place so we can take care of Oliver. So the first thing we're going to do is we're going to go through and we are going to chart, and we're looking for everything from crown defects to deep pockets, potential any defects that we can visually see, and we're going to chart all those. So we'll have a complete charting and evaluation of that mouth.
Pocket 3 on 104.
A dog have 42 teeth in their mouth. So a few differences. We have 30, including our wisdom teeth, and an adult human probably has 30. A dog has 42 teeth. So some of the similarities is just like you and I, in that first 24 hours, you get that biofilm, that waxy debris that we all get in our teeth. That's just bacteria. That biofilm will accumulate in the first 24 hours. In about 48 hours, that starts to mix us with saliva and the calcium and turn into the tartar. Within 2 weeks time frame, that bacteria from the plaque to the tartar starts to get into gingivitis, and at that point in time, that bacteria can start to get underneath the gum tissue, underneath that gingival margin, and that's when it goes from an aerobic bacteria to an anaerobic bacteria, and that's when it can get a little bit nastier and induce infection. And that's where we start to see some of the gum loss, some of the bone loss, some of the mobility to the teeth, and that's where we may end up having to extract some teeth.
Pocket 3 on 404.